One.
Hello, everybody. Good afternoon, and welcome once again to our weekly COVID-19 media briefing with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and for today's session, the public health update will be, as usual, with the County Executive, Dr. Earl Stoddard, who is the Director of the Office of Emergency Management and Homeland Security, and today we have Deputy Health Officer Dr. Jens Bridgers, who will also be participating in the public health update. In addition to that, we will be addressing the county's food security efforts, and we'll give you an overview of the county's efforts when it comes to the role of the Montgomery County Food Council. And for that, we have two additional guest participants today, Heather Brusking, who is the Executive Director of the Montgomery County Food Council, and Netta Squires, Senior Law and Policy Analyst, Emergency Preparedness Specialist at also the Montgomery County Office of Emergency Management and Homeland Security. Reporters, you should all have already permission to record. If you do not, please use the chat to request it. And we do have a hard stop today at 1:20 in the afternoon. And with that long introduction, I'll leave it up to you, Mr. County Executive, for your opening remarks.
So thank you again for joining us. Well into our 14th month, I guess. Hopefully we'll be getting to the end of this at some point soon. But as has been my tradition throughout this whole time, I will not give you a date. So don't ask me what date this is over at. It just will be over at some point. I want to make a couple of comments unrelated to COVID. First, I just want to say that, I was very happy with the verdict in the Derek Chauvin trial. And I think that verdict probably spared this country a lot of pain. A lot of people are in pain anyway. I would say that Mr. Shelvin got justice, but there will never be justice for George Floyd or for any of the other people who've been killed over, and we're talking years. This is not, George Floyd was not some sudden aberration. We're talking about decades and decades of abuse of people and the excessive use of force against particularly the Black community. And so there's not justice for them, but hopefully it's a beginning of a reckoning, and that the ability of prosecutors and jurors to do the right thing in this case will encourage other people to stand up and do the right thing. Montgomery County is on a path of reform here. We actually started down that road before George Floyd, and we are going to continue on that road until we're finished. So we are looking at our hiring policies, our recruitment. We're looking at the policies for what we expect police to do when they're on the job. We're looking closely at our training. We're looking at what things we can do to improve what we do in our department. And we're going to continue to work on that. But I did breathe a sigh of relief yesterday when the guilty verdict came back. And hopefully now we can get on to the real work of making the kind of changes to those kind of events, so that kind of event does not continue to repeat itself. And I think for all of us who watch the news, that's been repeated several times this week already. So this has got to come to an end, and we need to get to that work. This Friday, I'm going to be joining MCPS Interim Superintendent Dr. McKnight for a press event to address mental health supports for our students, the transition from SROs to more social workers and psychologists in our schools, as well as our joint efforts to address the unaccompanied minors that will be coming to Montgomery County. We are working closely together, and we thought doing a joint press conference on issues that are as important as this would help demonstrate to the residents of our county that these are complex social issues, and they're not going to be solved in the schools alone, and they're not going to be solved in county government alone. These are issues that require coordination between both of us, and we are wanted to make that point with this press conference. We're also celebrating Earth Week, and I want to note that tomorrow we'll be having a press conference at Glen Manor Condominiums. WTOP had a story this morning that the DC area ranks 20th in the nation for those most at risk from um, ozone. And that's not a good distinction to have. That's part of the reason why climate change is a priority. We're going to be addressing our current work and the progress we've made, as well as what we plan on doing moving forward. Montgomery County has been doing work on this for a while. The plan is not the beginning. The plan is a continuation of the work that's already been occurring, and we'll be talking more about this over the next couple of days, and hope that we can see some of the press there at these announcements there. I think they're important steps forward. On COVID, I want to say that our COVID case rate is remaining steady. We're in the low 9s per 100,000, and we continue to remain lower than much of the state and the region. In fact, we're probably the third lowest in terms of cases per 100,000, the second lowest in terms of our positivity rates. That is attributable to one thing and one thing only. And I'll say, the governor talked about looking at travel as the problem. Montgomery County travels as much as anybody else in the state. Our numbers are different. We've been successful because of the residents here. We've been talking about this, and we've been asking people to take these precautions. I know not everybody jumped up and down and said, yes, I love doing this. But the fact is that most residents have worked with us and followed the kind of guidance we've given. And because they followed the guidance, we have the numbers that we have. And because we have the numbers that we have, we're beginning to look now at how we move toward reopening. We'll be providing guidelines, metrics that are achievable metrics, not aspirational metrics. We know where we are. We know where we're going to be going with vaccines. We don't always know the supply because the supply is not quite materialized the way it was promised. But we know we've got enough supply to move in the right direction. And so you will be hearing more from us about where we're going to move toward reopening. And again, we'll be able to reopen safely because we're going to have low levels of community spread in Montgomery County, and that'll help make reopening a lot safer for everyone. We'll be sending this information over to the county council, so stay tuned and look for more. On the vaccine front, we're about to reach 50% of the total population of our residents vaccinated and 30% vaccinated. And when you take out the people who can't get vaccinated, it's actually a much higher percent. And so we're really happy about where we're moving with this. However, our Germantown Mass Vac site saw a 20% reduction in doses this week, in vaccines this week, which is really problematic. And that comes about obviously from the shortage of supply that is attributable to Johnson & Johnson being temporarily, we hope, unavailable, as well as the failure of other supplies to materialize adequately to replace what we lost from Johnson & Johnson. We hear that the state's concerned about the slowdown in demand. Montgomery County still has plenty of demand. As of Monday, we still have 125,000 pre-registered for vaccines. We got 624 new pre-registrants on Monday, 1,300 over the weekend, Saturday and Sunday. So we're continuing to get more people pre-registered. I think, and I've heard this, spoken about nationally, that as more people see more other folks getting vaccinated, and they don't see, the ill effects, and their friends and neighbors are, resuming life and, not having anything worse than maybe a sore arm and a cold the next day, that more people are being willing to get vaccinated now. So we're going to continue to push the vaccinations, and, we're trying to encourage the state to send more doses, frankly, to Montgomery County, because if they have to open up other places to walk in because they don't have enough people signing up to get vaccinated in advance, we've got people signed up and ready to get vaccinated. So, we feel that, it would speed our reopening, and we've got people who are waiting. If we don't need to open it up to walk-ups in order to fill our clinics. And we are actually going in large numbers to other parts of the state. And the information we got this morning is over 1,000 Montgomery County residents per day are going to Six Flags in Prince George's County and M&T Bank Stadium in Baltimore. 900 are going to the Fema site in Greenbelt, and 650 people are going to the Hagerstown site, and over 250 people are traveling to Charles County. That's a lot of people leaving the county for doses, and it would be a whole lot easier if, given what we're able to vaccinate, if those doses were actually located in the county so that our residents can get them here rather than going on these very, very, very long drives. And with that, I'm going to turn this over. We're going to be talking about food insecurity. During the last week's media briefing, we updated you on our vaccine equity efforts. Those continue. Today, we're going to talk about another important part of our COVID response, which was our dealing with food insecurity. We know that when businesses closed up, that people lost jobs. When people lost jobs, they lost the ability to pay for food. Unemployment was very generous for a short period of time, but after a while it resumed, previous levels of unemployment. And when unemployment was not supported by the federal supplement, it goes down to a maximum of about $434 a week. Paying rent and feeding your family on $434 a week is a real conflict. And so the county has stepped up in a big way, and with our partners in particular, to distribute food throughout the county to families and children who need food support. We've distributed nearly 25 million pounds of food. 25 million. 12 million prepared meals have been distributed, and 15 million MCPS meals were distributed to MCPS students. So that gives you an idea of the scope of what we've put out. I mean, Montgomery County is, I've had people comment on, this is a wealthy, affluent county, and then they look at these stories with the food lines. The food lines are real. The hunger is real. The need for the food is real. It's real even if it is Montgomery County. And it's real because we're home to a lot of workers who do not enjoy the affluence that many of our other residents do, and a number of workers, large numbers of workers, who lost their work during the pandemic. So we're still providing food, and tonight I'm actually going to be joining the Montgomery County Muslim Foundation's virtual iftar for Ramadan. And MCF, Montgomery County Muslim Foundation alone, has distributed about 211,000 pounds of food and served 3,300, almost 3,400 meals. And all our nonprofits, the faith community and the volunteers working in partnership with Montgomery County government have really made a difference. And I've said this before, it's worth repeating. The reach of Montgomery County is really the reach of the county plus all the nonprofits and partners we have. We would not be able to get as much done. We would not be able to reach as deeply into the community. And we would not be as able to meet the needs of people who really need our support if we didn't have the support of the nonprofits. So I just want to thank you. And we'll be turning this over later to Heather Ruskin from the Food Council to talk about the work they've been doing. And I'm going to turn this back to Dr. Bridgers and Dr. Stoddard now for their updates. So thank you all very much. Look forward to your questions.
Good afternoon, everyone. Happy to provide a brief public health update on behalf of Dr. Gales, who's attending a workshop and meeting at the Centers for Disease Control and Prevention. Our county executive illustrated some great data points. I just want to graphically share with you some of those data points and briefly highlight on some of those data points along our vaccine effort. Please keep in mind that as I share my screen, these data points may have changed over the last 24 to 48 hours as we receive daily updates. And so as the county executive indicated, the current Case rate in the county is 19, in the state of Maryland is 19.94. We currently sit at 9.14 as the third lowest, outside of the other counties that are represented here. Our test positivity rate is 2.90, which is a little less than half of the statewide test positivity rate at 5.28. We continue to be the third lowest or highest county to administer doses. We've administered 46% of our doses versus the state's 39% of at least one dose, and 29% of our counties are fully vaccinated. We vaccinated at least 83% of our 65 and older county to receive at least one vaccine and one dose, and then we fully vaccinated at least 74%. We continue to administer the doses on a moderately high rate during the course of the week, and we anticipate that we will have expended all of our doses or administered all of our doses by Friday or Saturday of this week. We did receive about 7,000 doses for this week for our local county health department. We continue to apply those doses and work in collaboration with our Minority Health Initiative partners who presented their great work last week in those 13 highly prioritized zip codes. We continue to monitor our hospital data, which is low and maintained at a moderate pace. So we continue to employ those strategies. This week, we anticipate that we will administer about 25,000 doses this week, about 18,000 second doses, and about 7,000 first doses, as I indicated before. That's a brief update, subject to any questions, and I will now turn it over to Dr. Stoddard for his update.
Thank you, Dr. Bridges, and thank you, everyone, for coming back. A few things I want to touch on, and I think the last point that Dr. Bridges made is an incredibly important one. Between the 18,000 second doses, the 7,000 first doses, and the nearly 5,000 doses at the mass vaccination clinic, Montgomery County and its partners will be doing nearly 30,000 doses this week alone. And as Dr. Bridges alluded to, we expect to expend all but very few of those by the end of the day on Friday, perhaps into Saturday. And so, we've gotten some questions about the mass vaccination site. We've been doing about 1,250 or so a day, just to pace it out over the course of the week. But I would expect the allocation for the first doses for that site to be expended on Friday as well. We do have some second doses that we will do at that site probably on Monday. But obviously, until we get a reload on Monday, there likely won't be first doses available on Monday, just because we'll run out. As the county executive alluded to, we are still seeing significant demand in Montgomery County. Of the 125,000 or so, 126,000, I believe, who have pre-registered who have not yet received a vaccine. We still have about 47,000 people who have not received even a single invitation to a clinic yet, because we just haven't gotten to their name yet. And so we are definitely in need of some additional vaccine, and we're hoping that the state, if they have other areas across the state where they're not seeing as much interest, will reshuffle the deck to those places in the state that are still showing that high demand. And so obviously that makes sense, and we hope that the state will do that. On a couple other fronts, we do have a meeting with the Maryland Emergency Management Agency and the Federal Emergency Management Agency about opportunities for pop-up vaccination clinics being coordinated with FEMA. And so we're targeting the week of, I think they're targeting the week of May 4th through 9th. We're going to identify a location with them to hold an opportunity in some of our more diverse or areas of lower vaccination rates. And so obviously that will be something that we're working with them this afternoon on, and to be able to talk more about in the coming week. We are still over the last week, we have seen a little bit of a reduction in the return rate on some of our appointments, where it fluctuates between, we send out basically, 50% of our appointments or invitations come back or accept those appointments. It's actually down a little bit this week to about 25%. So we're having to send out 4 invitations for every one that comes back. So we will move through that pre-registration list at a pretty rapid rate, and we're hoping over the coming weeks that as the public behavior of responding to our requests for invitations wanes, as it has in other counties across the state, we will eventually be able to move to a different model whereby people either can make their own appointment directly through the system, or perhaps eventually be able to do walk-up appointments with no pre-registration. We're not there yet. We obviously still have plenty of people who have not yet received even a single opportunity to be vaccinated, but we do want to make sure that people understand that there will be an opportunity for that in the future, likely sometime in May, but that we're going to let public behavior around filling our appointments spots dictate when we're ready to move to that next phase of vaccination, rather than forcing it upon the system when there are still plenty of people who have not even had a single opportunity to be vaccinated yet. We are pleased that the Board of Health did pass the most update regulation with the graduation guidelines that we helped develop based on the guidelines that exist in the District of Columbia. Obviously, when we have been able to, we've certainly wanted to leverage there being consistency across the region. And so their guidelines were very well developed, and we sort of tailored those to Montgomery County, and Board of Health acted to pass those. They do apply both to non-public and public schools, and we are working very closely with MCPS, and we'll be having a meeting with the non-public schools to similarly describe those efforts. Those are all I wanted to touch on with COVID, but I did want to have a nice transition over to our food team. I know they've already been introduced, but I think it's really important to understand that we don't talk about food security nearly as much as we should. And I think that's because the effort that's been established, not just by the county, but in concert with our partners, our nonprofits and others, has been working. There is tremendous need in our community in food insecurity, but I think that need is being met in a really comprehensive way by the partners who have worked so closely together. And you know, so much of our time is spent on things that are not going well or not going the way we would all like them to. This is a real example of where government can partner with nonprofits and other partners to ensure that a community need is met. And I think it's an exemplary example of just how well that relationship can work. And so I think people should understand that the reason we don't hear so much about food insecurity, despite it being a major issue, is because what we're doing is actually working. And so I think that's an important thing I would use as a transition to our food security task force. So with that, I'm finished.
Thank you, Dr. Stoddard and Mr. County Executive, Dr. Bridgers, for that public health update. And now, as you mentioned, let's hear about the county's effort regarding food security with Heather Brosking and Nita Squires. Ladies, which one of you is going to go first? Because I know this is a team collaboration thing.
Thank you, Lorna. And can you see my screen okay? Wonderful, thank you. First of all, thank you for having us, and good afternoon, everyone. As you know, the county executive pointed out, when we think of Montgomery County, it's really hard to imagine it as a food insecure county. But the reality is that the COVID-19 pandemic and the resulting economic distress triggered this massive food access crisis in the county and throughout the region, and deepening inequities in our local food system as unemployment, small business closures, and health disparities rose. Montgomery County actually has seen an estimated increase of 50% in the number of residents accessing food assistance services since mid-March. So from 60,000 pre-pandemic to over 100,000 residents currently. And actually the most recent revised Feeding America projections puts food insecurity in the county at 11.1%, which is a 39% increase from our pre-COVID levels. So with that backdrop, in early April, the Food Security Task Force was created as a response to the COVID-19 food crisis to really facilitate the food distribution network that was struggling under this massive increasing demand as food security grew and supplies substantially decreased. The task force was a collaboration between the Department of Health and Human Services, Emergency Management, and the Food Council. And it really, as Earl, as Dr. Stoddard pointed out, it served as this example of the importance and strength of pre-existing private and public partnerships and following and practicing emergency management principles and frameworks during a major crisis.
So it's important as we're talking about the impact of COVID and the pandemic on our food access in the county to really highlight some of the pre-COVID food insecurity initiatives in Montgomery County. In 2017, the county government and the Food Council co-created the Food Security Plan, which had a shared vision of our community as a place where all people at all times have access to safe, sufficient, nutritious food. And the 3 years of work and investment that the Montgomery County put into plan implementation, and that included network building, resource development, and data collection, laid the critical groundwork that enabled quick mobilization of resources in the initial weeks of the COVID-19 response. There are varied, interconnected, and complex root causes for food insecurity, and certain populations in our county are at increased risk for hunger, and that includes children, seniors, people with disabilities, and foreign-born residents. In addition, a number of people in our county fall into the gap of earning too much to be eligible for federal assistance programs, but not earning nearly enough to make ends meet. And as a benchmark, a family of 4 to live in Montgomery County with the most basic amenities need to make an annual income of over $91,000 a year. And that's more than double the maximum income level to receive benefits like SNAP and WIC. The health impacts of hunger also disproportionately affect our county's children and people of color. According to the Maryland Department of Health, the Maryland Youth Risk Behavior Survey, which was administered before the pandemic, found that 18% of middle and 22% of high school students in MCPS are food insecure, and Black and Latino students are 5 to 6 times more likely to be at risk for hunger. So I'm the executive director of the Montgomery County Food Council, and just for a bit of context, we're a nonprofit organization that serves as the primary connection point for businesses, nonprofits, government agencies, and residents around food system issues in our county. We bring together over 2,000 local and regional partners by leading community-wide collaboration, advocacy, and capacity building initiatives, all within the framework of addressing food justice and cultivating a more resilient, sustainable, and equitable local food system. So we've had the honor of being the lead nonprofit organization coordinating the effort of over 400 partners, including nonprofits and government agencies engaged in our food security response during the pandemic. And one thing that we really want to highlight is that one of our county's greatest assets in our fight against hunger is our interconnected network of county's food assistance providers. There were about 75 before March of 2020, and approximately half of those are faith communities. And despite concerns that many providers would be forced to close their doors during COVID, since March of last year, our county has seen a 50% increase in the number of organizations engaged in food assistance work, jumping from 75 to over 120 nonprofits, faith communities, and other groups doing pop-up and regular food distributions. And this image shows the Food Council's food assistance resource map, and that's a searchable database that is updated weekly of all the food assistance programs available in the county and currently used as a key referral tool in our food access call center and around the county.
In May of 2020, the Food Security Task Force drafted a COVID-19 pandemic food security response strategy, and it outlined the necessary steps to take to expand the current food assistance network. And the goal was simple. It was more food to more people. And I just want to highlight some of the programs that we did to achieve that. So to increase food, we infused food directly into the network by purchasing and delivering millions of dollars of food from local wholesalers whose businesses were gravely impacted by restaurant closures. We also did bulk food purchases through food banks, which increased the buying power of our 2 major local food banks to get millions of dollars of extra food in and through it to the existing system. We created grants that increased purchasing power and capacity building for organizations, and we invested in expanding the farms right here in the county to help infuse more local produce.
And so with so many providers, many of which are brand new to distributing food, it was critical to connect and coordinate efforts as much as possible. And so some of the examples of the more food to more people, the enhanced coordination aspect of this response. We needed to make sure that all of our food assistance providers had access to the resources that they needed. So in addition to food, accessing PPE to ensure the safety of their staff and their volunteers. Getting additional information on policy changes, knowing that especially the landscape of resources at the federal level was changing from month to month, as well as services beyond food, recognizing that our residents who are experiencing food insecurity likely need assistance with utilities or housing assistance as well. We made sure to facilitate partnerships and coordinated service delivery from provider to provider, especially focused on organizations that were geographically close to each other, and creating a community of practice with thousands of staff and volunteers and community partners so that they were both aware of each other's services, but more importantly, sharing their challenges and their best practices so that they can learn from each other and grow as a sector. We provided regular training on operational strategies, including safe operations during COVID, operating during cold weather outside, which was a new thing even for organizations that had been providing food assistance for a long time. Also enhancing our communication strategy, internal, helping our food assistance provider organizations access the vaccine, but also external, connecting information about food assistance resources to residents in as many ways as possible. And that included print flyers, as well as a variety of online resources, setting up a food access call center, so then a variety of language support to residents who couldn't access resources online, and also directly investing in community navigators. People in our communities, leaders who have trusted relationships, and organizations that have trusted relationships with hard to reach populations. We've invested in a data collection platform and support so that we can really have a better understanding of the breadth of all of the resources that are available and track changes and trends on week-to-week basis. And engaging our non-government funders, an innovative public-private partnership with the Greater Washington Community Foundation's Food for Montgomery, which is bringing in our private sector partners to invest and engage in this work as well. And then finally, most importantly, providing leadership opportunity for community voice, listening directly to residents to ensure that policies and programs are informed and driven through feedback loops with residents, and having, for the first time ever, a direct resident survey around food access to really hear from our residents on what their food access challenges are now as compared to before the pandemic.
Just taking a look, you can see here kind of at a glance some of the accomplishments that the county achieved through this coordination and response effort, creating 8 service consolidation hubs, each providing food to their communities, extended communities, providing millions of dollars in grants to build capacity in infused food. You can see here some of the total beans, rice, and lentils that were distributed, over 700,000 pounds. And this was really an operation that was intended to make sure that we had cultural staple foods when these were not available to buy in small quantities. And so the county purchased them, repackaged them, and then redistributed them back to our food assistance providers to put into the network. And distributing over $15 million through MCPS students, even under the harshest distribution and access conditions. So these are just really kind of at a glance some of the accomplishments, prepared meals that were served to residents when they were in homes and unable to leave because they were seniors under lockdown. So in emergency management, we say that the best time for implementing mitigation strategies is post-disasters. And so as we're looking at this post-COVID-19 world and recovery, we're really working towards improving the existing system and the pre-existing food network system to try and make it stronger, more sustainable, and more resilient. Thank you very much for having us, and we're very happy to answer any questions.
Thank you, ladies, for that presentation. Very impressive. And now let's get started with the question and answer portion of this program. Unfortunately, we have less than 14 minutes, hard stop at 1:20, to answer some of these questions. And let's get started with you, Randy Bass, WDVM, who has questions for the officials. Randy?
Thanks so much for taking my question. Officials, in your opinion and based on the data that you have, why are Montgomery County residents so willing and so ready to get this vaccine compared to other parts of the state? We've talked about vaccine hesitancy, but what's contributing to vaccine willingness, if you could call it that?
So Randy, thank you for your question. I will take a initial stab if I heard it. It came in broken at the beginning. So if I don't get it all, please restate the part that I missed. But I think that folks are encouraged to get vaccines. If that's your question, they're willing to go outside of those parameters. They hear a lot of information. Our comms team is working very diligently to not only provide the information as far as sites and location and availability of vaccine sites, but information that would encourage them and reinforce the efficacy of the vaccines, even with the J&J, and as ACIP is scheduled to meet again on Friday, already have begun to plan information and targeted outreach strategies to our countyans and those individuals who are at risk and underserved to create even better access and equity. More recently, with the state opening up to all individuals 16 and older to receive a vaccine, we realized early on that a lot of countyans were going outside of the county to get vaccines and to travel, as Mr. Elrich indicated in his opening remarks. And so we are continuing to educate the countyans, members of the county, about the vaccine, the efficacies, and where to obtain the mass vaccine site was just an added measure to increase our vaccine output. And so we continue to push the messaging. Education is the key, and we continue to educate the public, if I answered your question.
What I would also contribute to is that we have a pretty well-informed population in Montgomery County. Significantly high scientific literacy rate in Montgomery County, which I think people will sort of take to the science and the recommendations of public health. And we see that in our COVID numbers too. We have a population that's very willing to follow the guidance and guidelines of our public health leaders, not just in the county, but across the country. And so I think that well-informed population matters. One of the areas where we've seen the most, and this is a national thing, one of the most significant populations that have shown hesitancy around the vaccine are actually conservatives. And so obviously Montgomery County is very progressive in its thinking. And so I think we're less likely to see some of that scientific hesitancy around the science of vaccinations as well. But I do think it's, we try and keep people informed, and they are receptive to that message. And they're paying attention to not just what we say, but what's out there, and being very discerning readers of the media and the scientific literature. But I think that's contributing to a population. But again, we've also, as we've talked about with our equity last week, we're trying to really get into all diverse communities, even those who are not as keen on or following the scientific guidelines on a day-to-day basis. And so we've really tried a diversity of methods to try and address our population. I think that they're taking our guidelines as well as that of everyone else, the other experts that are out there, and taking it to heart.
So I'll just add that I think one of the things from the beginning is that we have emphasized public health as number one goal of what we're doing. It is, nobody's confused that we're trying to drive cases down and the spread of the virus down. And we have stuck pretty closely to the CDC guidelines. And so in other jurisdictions where you see the CDC saying one thing and political leaders saying something else, and then watching wild spins and their numbers going up and down, I don't think that contributes to people having a level of trust. And I think having us consistently keep ourselves in line with the CDC has been very helpful for people, because like Dr. Stoddard said, we have a very literate population. They know when people are diverging from what the best medical advice is. We've not done that, and I think that has helped people have a higher level of confidence in the path we're on.
Thank you, gentlemen. Is that good enough, Randy?
Yes, thank you so much. I'm not sure who else is interested in asking questions, but I do have another question, but I will let others ask their questions. I know we're short on time.
Okay, thank you so much. Thanks for understanding. Next is Dominique Bonessi from WAMU, also with questions for Dr. Stoddard and Dr. Bridgers. Dominique?
Thank you so much. Two questions. One, could we get a few more details on the Fema site? Is this like the site that we saw over in Greenbelt that was for sort of a walk-up site without an appointment? And then the second question might be for Ms. Squires or, I'm so sorry, I forgot her. Bruskin, thank you. Regarding the food access bill that would have allowed grocery stores to sell alcohol, that didn't go anywhere in the General Assembly this year. You know, there was a statewide bill and there's a county bill for Prince George's County. I'm just wondering, you know, you had any thoughts on that bill and whether that would make any difference for people in just gaining access to food, especially if they're in areas where public transportation isn't easy to find to get to food. Thank you.
So on the first question, oh, sorry, Dr. Bridges, if you want to go ahead.
No, go ahead.
I think we have the same amount of information, which is not a whole lot.
It's the same thing. And since you've been monitoring the sites, the only thing that I was going to, you know, add is, Dominique, we are working towards the walk-up sites. We haven't gotten there yet. We still have 125,000 folks to vaccinate, as the county executive said. And so we are thinking long-termly now, what happens, what are our next steps in our measured approach to vaccination. So I'll turn it over to Dr. Stoddard to add more information to those strategies.
Yeah, so the specific site that we're talking about that I mentioned in my update was there is a FEMA site that we're going to look to stand up. It is not going to be a static site like the Greenbelt site, which is going to be for perpetuity. This is going to be a targeted effort for about I think a week in the first week of May is what they're targeting. They're doing these pop-up opportunities in various different places in concert with the state's equity task force. And so we were approached with an opportunity to hold such a clinic in Montgomery County, and we're going to work with them to identify a location. It comes with about 500 doses typically at these locations. So it would be just for that 1 week, but hey, 500, I will not, 500, if anytime they want to have a 500 dose clinic in Montgomery County, we will be happy to host them.
And then addressing the question about the bill in the General Assembly, the Food Council didn't weigh in specifically on that proposed policy this season, but I do really appreciate the attention to having as many food access sites as possible available for our residents, particularly those with access to affordable, nutritious foods. And so just really want to highlight there were some real achievements made policy-wise at the state level this legislative season around increasing access to SNAP. And it's really important wherever possible to provide resources that make food that often costs more. Unfortunately, if we can't adjust the costs of food, we can certainly make it more accessible for residents with nutrition benefits like SNAP, and also double dollars programs at farmers markets, which are both supporting local businesses and local food producers while also increasing food access for residents. So always want to make sure we have opportunities to balance supporting locally owned businesses, including grocery stores, while also providing as many outlets and convenience for shoppers as possible.
Thank you. Thank you, Dominique. Randy, I think we do have a couple of minutes for your follow-up question.
Wonderful. Thank you so much. I'll be fast. Has there been any change in how the county is prioritizing residents for appointment invitations? What are the biggest factors influencing when someone's going to get their turn to get an appointment here?
So thank you for that question again, Randy, and Dr. Stoddard and our team have been working on the prioritization. We had our prioritization and our phased approach leading up to April, when the governor changed the phased approach to the priority approach to the phased approach. And so we continue to pull through those names and look at those names and provide greater access to work with our partners, our minority health initiative partners, to provide more equity and access. As Dr. Stoddard indicated, that we anticipate that the doses that we receive may run out by Friday, but we still have Saturday and Sunday with our minority health initiative partners to provide greater access. We also have partnered with our hospitals and other community level partners such as Safeway to look at greater access point to provide additional doses. The challenge is to have the clinical staff and the vaccinators to increase the high throughput. And so we're working collaboratively with all to increase and go through our list. We have an exhausted list and we still need more doses, which is plainly put. And so that's pretty much the strategy as we continue to go through prioritization and identifying folks. We've sent initial registration links and second links to individuals, and we provide a platform for individuals who may have missed an appointment to still get vaccinated, who may have been in an earlier priority grouping. And so we continue to move progressively through those to ensure that all get vaccinated. And so that's pretty much the update that I have. Dr. Stoddard, anything you'd like to add to that?
Yeah, we just said the key factors are we're trying to align the vaccine to those populations that have experienced the most suffering as a result of the COVID-19 pandemic, particularly our Black and brown residents in particular zip codes where there has been disproportionate spread and disease and hospitalizations and deaths, candidly. And so when we prioritize, we focus on those zip codes that we've seen the highest cases and spread in, and we preference. We don't, it's not like other places aren't getting vaccinated, and our map reflects that. It's just that we weight towards the locations where spread is most prevalent, and I think that's probably in part why we're also seeing the reduction in cases that we've seen, is that we've been very effective at targeting the places where COVID-19 is actually spreading, and thus actually breaking chains of transmission in those neighborhoods as well. So.
And one thing just to add that comes to mind as part of that prioritization and equity framework, we've included and increased our outreach in these communities where we may not see those data points, but we know that there may be a need or better access. And so we're using our outreach strategies and our community level ambassadors to help provide additional information within those at-risk communities.
Gentlemen, we have about 1 minute and 30 seconds left. Actually, a minute. Brianna Hikusuma has a question for Dr. Stoddard regarding the FEMA pop-up. Real quick, Brianna, let's get you in.
Yeah, I'll try to be quick. I just had a quick question. I know you mentioned that it'll be in an area with lower vaccination rate. What are the areas where you all have seen lower vaccination rates, and what do you attribute the reduction on the return rate for appointments to be? Do you think it's people getting vaccinations elsewhere? What's causing that?
Yeah, so I think we've shown a map, and I think we showed it last week in the equity presentation. I think we've shown it at council as well. So we have a few areas in the county where we still need to do, like we've made real progress in the vaccination rates in many parts of the county. We still have work to do to really to reach equity, as we would say, and that we're going to keep working to do that. And there we go. And so these are still places where it will absolutely be in one of these zip codes, and as we have additional opportunities, we'll expand to others. But we're going to look for places where there's a divergence between the rate of COVID and the rate of vaccination, and that's where we'll target. I don't know where that's going to be. Like I said, our meeting with the state is not until 2:30 this afternoon, and so I don't want to preface that conversation until we see it. Yeah, I'll provide more info. And on the second question, I'll give you a 15-second answer because I know we're over time. We've seen these variations, and I think it's probably people getting vaccinated through other means. They've been able to access it through the mass vaccination sites and elsewhere. And again, that is part of our calculus for when we do move to those next phases, whether it be open registration or select your own appointment type registration. We're going to watch the rates and how many people it takes to fill clinics, and that will help drive it. We are seeing a little bit of a change of behavior this week compared to last week. And so if that becomes a trend and not just these 1 week variants, then that we may start to more seriously consider how we're going to move forward.
Thank you.
Thank you, everybody, for participating and joining us today. We'll see you again soon. Stay safe. And any further questions from reporters, please do send them to the Office of Public Information. Thank you and good afternoon.
Thank you.